As globally, concerns grow here at home. Good evening, I'm Joey Parker. While President Obama and national health experts try to get a handle on the Ebola crisis, tonight officials here in mid-Missouri are also discussing what they would do if Ebola comes here. Today, several members from local health departments from around the state, met in Jefferson City to run through different scenarios to break down their response in detail. Right now, ABC 17's Ashley Strohmeyer joins us live at the training facility. And Ashley, we know they tell us this is a precautionary measure.
Joey, this meeting lasted about 3.5 hours and was invite only. A health official in the meeting says it was a tabletop exercise, which basically means they broke off into different groups to discuss different scenarios if an Ebola outbreak happened here in Missouri. She also tells us this was an information sharing meeting as well. Everyone shared their knowledge of Ebola as well as symptoms and protocol that they would take if it came here and how they would respond to it if it happened. And I'm also told about 150 people from around the state were at this meeting. This includes people from health departments as well as first responders all around the state. Live in Jefferson City, Ashley Strohmeyer, ABC 17 News.
Virus that doesn't spread through the air and that we do know how to control. We do know how to stop it.
Just this afternoon, we learned a Norwegian staff member from Doctors Without Borders has become the latest international Ebola victim. The Coast Guard is also stopping ships right now trying to find passengers with Ebola in parts of New York and Connecticut. So far, there are 6 cases here in the U.S., 5 Americans and 1 man, of course, from Liberia. All of them got Ebola in West Africa. There's only 1 person who didn't get sick there. It's a nurse from Spain who treated a priest with the virus. Today, officials put 3 more people in quarantine because of that nurse. This latest outbreak has killed more than 3,500 people worldwide. Twice as many are infected. Tonight, some hospitals in New York City are sending in fake patients to see how doctors react to their symptoms. And state leaders in Louisiana are also increasing security.
If they're not feeling well and they come from somewhere where Ebola was, it is handled where they will be isolated until we can answer that question. Are they ill because of Ebola or not? If there's a risk.
A hospital in Kansas City also went on lockdown over the weekend for a man with a fever who was reportedly from Nigeria. The police blocked his apartment, and it appears he got malaria instead. He was released yesterday. While 5 Americans get treatment in the U.S. for Ebola, tonight there is growing concern the virus could make its way to mid-Missouri. Today, ABC 17's Heather Horrigan checked with hospitals, schools, and health departments on what plans are actually in place. And Heather, you found there is a plan.
Yes, there is, Joey. If someone were to get Ebola here in mid-Missouri, hospitals have been prepared. The health department will monitor those exposed, and the schools could enact a screening process.
We certainly are watching this closely, and we're worried about, what's going to happen next.
It's been 2 weeks since officials confirmed the first ever case of Ebola in the United States. Since then, the CDC has been stepping up its efforts to help local health departments. Andrea Weiner with Boone County's health department just got off the phone with the CDC before our interview.
We've got infection control plans in place should something happen. So the whole thing is about preparedness, and I think that we're ahead of the curve on that.
Cole County's health department tells me along with educating the public on Ebola, it would monitor people who had come into contact with someone infected with the virus. Health officials work with emergency management as well as the schools to prepare a plan if a virus like Ebola was to come to mid-Missouri. It's a plan that is reviewed every year and includes many different diseases.
It could be everything from whether or not we need to close schools to clean them, whether or not we need to be doing testing, whether or not we need to be providing health shelters, emergency clinic space, all of those types of things. It really depends on how widespread it is, what type of virus it is, and what sort of protections we need to put in place, not only for our students, but our staff and our immediate community.
And while emergency plans are constantly being reviewed, local hospitals say they have been prepared for this. University Hospital has isolated rooms and bathrooms, which the CDC recommends, as well as an infectious disease team.
There's a whole group of people whose job it is to deal with this sort of thing. And many of the things we deal with are actually more contagious by far than Ebola.
Cooper Stock says the university is actually ahead of the curve, announcing this week the use of 4 ultraviolet robots. These are machines that emit light to kill germs in a room. Ebola is one of the pathogens the robots can kill.
Thank you, Heather. This Ebola concerns comes just months before flu season. Dr. Cooper Stock says each year about 20,000 people in the U.S. die from the flu. Right now, there are 3,000 people in the world have died from Ebola, as we mentioned a few moments ago. Columbia Public Schools will start giving flu shots, by the way, to their students tomorrow. Tonight, some residents near Hickman High School are